Good morning. Today we're going to share details on the Commonwealth's plan to vaccinate homebound individuals and give an update on vaccine doses being distributed this week to providers. We'll also share details on plans to distribute recently passed federal funding to some of the hardest hit communities here in the Commonwealth. First, I want to give a quick update on the Commonwealth's COVID data. Yesterday, the Department of Public Health reported 1,865 new cases on 106,349 tests. Over 18.2 million tests have been reported this week, and this week we passed the milestone of over 2 million tests being conducted at the Commonwealth's free Stop the Spread testing sites. 628 individuals are in the hospital being treated for COVID, and 147 are in the ICU. That number's down since March 1 by about 20%. COVID hospitalizations have declined over the past few months, due in part to our success in vaccinating our most vulnerable residents, particularly people over the age of 75. We're now seeing more positive cases for a different age demographic, people under the age of 30. While these residents are far less likely to be hospitalized, it remains critically important for all residents, and especially young people, to continue to practice prevention strategies and not let down their guard. As a reminder, our mask order and many of the industry safety guidelines that we developed over the course of the past year remain in place, and we urge the public to continue to be vigilant with respect to the virus. Vaccines are here, and that's a great thing. But we're still in a race against time, especially as supply remains constrained. To ensure that we can stay on track and beat back the virus, provide vaccines, and get back to normal, we continue to urge residents to do your part to stop the spread. This includes using the Commonwealth's free testing sites if you've been exposed to COVID or feel sick. It's important to remember, and we've said this many times, that many of the people who get COVID are asymptomatic, and many of the people who transmit COVID to others are asymptomatic. If you've been around folks who've tested positive, it's important that you get tested, even if you don't have any symptoms. Testing is a key part of our strategy of pushing back on the virus over the past year, and it has been very effective. We continue to be one of the largest testers per capita in the country, and we have a massive testing infrastructure here in the Commonwealth, with over 400 sites available to be tested. Free testing is widely available, including at the Stop the Spread sites, which we've extended through the end of June. Doing your part and getting tested if you feel sick, or even if you've just been exposed to people who've been tested positive, is a very easy way to protect yourself, to protect your friends, to protect your family, and to protect your communities against the spread of the virus. On vaccines, over 1.1 million individuals are fully vaccinated here in Massachusetts. Over 2 million individuals have received a first dose, which includes the single-dose J&J vaccine. And thanks to the hard work of our healthcare workers, Massachusetts continues to be a leader in getting vaccines to our residents. We're in the top 10 of all states in doses per capita, and we're the #1 state among the large states that have more than 5 million people. According to Bloomberg's vaccine data, Massachusetts is the first large state in the country to vaccinate 30% of our population with a first dose. While there's still more work to do, we're the #2 state, according to the Bloomberg data, in dosing Black residents, and we're at over double the national average for Latinx residents. And we've made tremendous progress in vaccinating our older residents as well, who are the most susceptible to serious illness from COVID. Over 80% of residents 75 years or older and 68% of residents 65 and older at this point have had a first dose. We're optimistic the federal government will deliver on bigger shipments of vaccines as we go forward, so that we can continue to make progress in making sure that a vaccine is available to everybody who wants one. Now, for the week of March 22nd to March 29th, which is the week we're in now, the Commonwealth received 330,000 first and second doses as part of our state allocation from the federal government. That state allocation includes 183,000 first and second doses from Pfizer and 139,000 first and second doses of Moderna and 7,900 doses of J&J. That's in addition to the roughly 140,000 doses the federal government has allocated directly to community health centers and pharmacies through the Federal Retail Pharmacy Program this week. The Federal Retail Pharmacy Program received almost 116,000 doses, and the state allocation for retail pharmacies is another 10,000 doses. And between the state and federal allocations, community health centers received about 54,000 doses. And as part of the state allocation, health systems and healthcare providers received 115,000 doses, mass vaccination sites received about 109,000 doses, regional collaboratives received about 44,000 doses, and local boards of health received about 12,000 doses. Mobile clinics to support long-term care facilities, congregate care facilities, affordable and low-income senior housing, and homebound individuals received just under 10,000 doses. There are currently over 200 public vaccination sites available across the Commonwealth. We're starting to see an increases in doses provided by the federal government, which has allowed us to continuing opening up our eligibility categories. And we've been informed that we're going to receive about 40,000 additional doses of the one-dose J&J vaccine next week, which is great news. But we still see a constrained supply with respect to the demand we have and the capacity we have to put shots in people's arms. If you're looking for an appointment, you should anticipate that it could take several weeks to find an opening. Last week, we announced the dates when all people in the Commonwealth will be eligible for the vaccine, with the general public becoming eligible on April 19th, Patriots' Day. And as a reminder, if you're seeking an appointment at a mass vaccination site, you can pre-register for an appointment at mass.gov/COVID vaccine. You can also look for appointments at other sites like retail pharmacies, regional collaboratives, or the many provider organizations that are vaccinating both their patient panels and, in many cases, people in their community as well as the CHCs. Most healthcare providers, especially hospitals, have provided instructions to their patients on their appointment process if they are administering vaccines. As part of our distribution plans, we're working to ensure everyone has access to a vaccine once they become eligible, including those who can't leave their homes due to medical conditions or other circumstances. The Command Center has been working to set up a program to reach these individuals that will leverage the experience of local boards of health and establish a statewide homebound vaccination program with the Commonwealth Care Alliance. Local boards of health have been partners in the fight against COVID, and their close relationships with their communities make them uniquely well-equipped to support homebound vaccination. We announced back in February that we're eager to work with every local board of health in Massachusetts to vaccinate homebound residents, and the new program we're launching enables every local board of health to either choose to launch their own program for vaccinating their homebound residents, or they can choose to enroll in a statewide program and work with us that way. This effort will complement the work that's already being done by providers, health plans, and hospitals to vaccinate their homebound patients. If your loved one is homebound and need to schedule an appointment, you can call the Homebound Vaccination Program Central Intake Line at 1-844-771-1628. 1-844-771-1628. The line is open Monday through Friday from 9 to 5, and the line's available in English and Spanish, and there are translators available for 100 other languages. Secretary Sutters will talk more about this program in a minute. The Homebound program is another example of how we're working to bring the vaccine to residents so that for whatever reason, if they need more support and access to vaccines, we can work with our collaborative partners to make it available. We continue to work with local boards of health and other community partners to reach residents in the 20 communities that have been most disproportionately impacted by COVID-19. In these 20 communities, the local boards of health serve as vaccination sites for residents and collaborators with many other provider partners in those communities. The Commonwealth is currently investing $33 million in increasing access to vaccines in these communities, and in public awareness and outreach efforts. This includes a $2.5 million public awareness campaign utilizing trusted voices to address questions on vaccine safety. We're also launching a grassroots campaign led by Archipelago Strategies and Healthcare for All, which will go door to door and make calls in several languages to help answer questions about vaccines and assist people in signing up for and making appointments. The data tells us that so far, those outreach efforts are working to get people vaccinated over several demographics, but we know there's a lot more work to be done here, and we look forward to building out these strategies and more. Our administration continues to invest in COVID-19 funding to support disproportionately impacted communities here in Massachusetts. And in response to a major shortfall in funding to certain communities under the American Rescue Plan Act, we are today announcing that the Commonwealth will allocate more funding to the 4 communities that were left behind by that legislation. Based on preliminary estimates, we expect the Commonwealth to receive a total of about $7.9 billion in direct aid, and about $3.4 billion of that will go to counties, cities, and towns. But as a result of the way the bill was designed, Chelsea, Everett, Methuen, and Randolph are due to receive significantly smaller levels of federal funding compared to many other hard-hit communities. We believe it's critically important that these communities get the resources that they need to continue to recover from the devastating effects of the pandemic. We've been talking regularly to local leadership in these 4 communities about this issue to develop a plan to make up for the shortfall. As a result of those conversations and discussions with the legislative leadership here, we're pleased to announce that we'll direct $100 million in additional aid to these 4 communities. When we get final details from the federal government about how exactly the money can be used, we'll finalize agreements with each of these communities. These 4 municipalities will be able to use these funds in direct aid to support costs related to the COVID-19 pandemic, including direct response efforts addressing negative economic impacts, replacing revenue lost during the pandemic, making investments in water, sewer, and broadband infrastructure, as well as other eligible expenditures, totally consistent with what other communities in Massachusetts resources. The Commonwealth expects to get additional details from the U.S. Treasury in the coming weeks around the final payment figures and additional guidance around the use of these funds. We also expect it to be several weeks before states are able to access any of these resources. I've been at this podium many times over the course of the past year to remind people in Massachusetts that while there are brighter days ahead, there's a light at the end of this tunnel. It's critically important for people to continue to do the things that work to stop the spread. I know it's been a long ride, and everybody's tired of playing this particular game, but we need to hang in a little longer. Vaccines are here. Federal government's starting to send more shipments. Massachusetts has stood up a significant vaccine site infrastructure with 200 available public sites, and virtually every resident of the Commonwealth lives within 30 miles of a mass vaccination site or within 15 miles of a regional site. Every resident in Massachusetts has an eligibility date and can pre-register now to get an appointment, and we've reached important milestones that demonstrate very significant progress, like over 1 million people here in the Commonwealth being fully vaccinated. Hospitalizations are down over the course of the past few months, due in many ways to so many of our vulnerable members and residents being vaccinated and protected from becoming deathly ill. We continue to make progress gradually and safely, and we will be able, as we do so, to reopen so that people can do the things they used to do. But right now, people need to stay vigilant, especially in those informal circumstances and situations where you aren't necessarily aware of or participating in the rules of the establishments that you may work in, shop in, or be entertained in. But it's critically important that we all remain vigilant as we work our way through this vaccine program over the course of the next several months. And with that, I'll turn it over to Secretary Sudders.
Governor, Lieutenant Governor, and we're joined today by Chris Palmieri, who's the President and CEO of Commonwealth Care Alliance, and Kelly Barrio, who is the Vice President of Clinical Services. As the Governor indicated, the homebound vaccination program will hit the ground running beginning next Monday, May 29th. It's been under the development for the past month or so. The program holds true to our core commitment to effective and equitable distribution of vaccine. We realize there's about 25,000 individuals who are unable to get to one of our vaccination locations in the Commonwealth because they're homebound. The program is designed for individuals who have considerable difficulty and/or require significant support to leave the home for medical appointments, or they require an ambulance or two-person assistance to leave the home, and they're not able to leave the home for medical appointments under normal circumstances. We are grateful to the 170 local boards of health for answering the call to action, once again, to distribute vaccine to some of the most vulnerable populations in their communities, including their homebound residents. This represents about 40% of our state's population. These local boards of health will administer vaccines for their homebound residents. Homebound residents of the 181 other communities, which represent about 60% of our state's population, will receive vaccines through the statewide service operated by the Commonwealth Care Alliance. Homebound individuals will be connected to in-home vaccination via healthcare providers, aging services access points, local boards of health, councils on aging, and other community organizations. Eligible individuals will be scheduled for vaccination as follows. They will be registered with the state homebound vaccine provider, which is Commonwealth Care Alliance, or they'll be referred to their local board of health to schedule an appointment if they reside in a community where their local board of health is doing the in-home vaccinations. If the individual is not eligible for in-home vaccination, the caller will be connected to the necessary resources that they need to schedule an appointment at a vaccination site through either our 211 call center. They'll be connected with transportation, either through Mass Health, if they're a member, or to their local community service for help. This is very much like a Velcro kind of connection. It's not just handing somebody off with a telephone number. In-home vaccinations will be performed by medical professionals following all public health guidelines, and we will utilize the Johnson & Johnson single-dose vaccine, which is easier to transport, requires no ultra-cold storage temperatures, and requires only one appointment. We have all worked together to reach many important milestones throughout this pandemic, and we must continue to work closely and collaboratively, local boards of health, healthcare providers, community health centers, and the like, encouraging residents to get the vaccine and urging everyone to stay vigilant. Now is not the time to let our guard down. We must continue to mask, be socially distant, and get tested when feeling ill or if we feel we've been exposed. Thank you. And now it's my privilege to hand this over to Kelly Barrio, who, as I said, is the Vice President of Clinical Operations. And just one quick second about Commonwealth Care Alliance. It is a Massachusetts-based, not-for-profit, community-based healthcare organization whom we've worked with for a number of years. They're dedicated to improving care for individuals who are dually eligible for both Mass Health, which is Medicaid, and Medicare. These individuals have complex medical, behavioral health, and social needs, including individuals with disabilities. CCA has been providing in-home vaccinations to homebound individuals enrolled in their One Care and Senior Care Options healthcare plans for the past few months, so they were the perfect partner for us to engage in a statewide homebound vaccination program. And with that, I will turn it over to Kelly.
Thank you, Governor Baker, Lieutenant Governor Polito, Secretary Sudders, and everyone at the COVID Command Center for your partnership in developing this critical program to vaccinate homebound individuals in Massachusetts. As a not-for-profit community healthcare organization, Commonwealth Care Alliance has been focused throughout the pandemic on putting people first as we prioritized the health and safety of individuals with significant needs, including creating the first protocols for administering vaccines in the home. Building upon more than 40 years of providing care in people's homes, we've been able to deliver vaccines to more than 500 of our homebound members in the past 5 weeks, and we are proud to be able to expand these efforts to more than 20,000 residents across the Commonwealth. This has been an unprecedented time in our Commonwealth and nation's history, and vaccines provide the best tool we have to end the pandemic. CCA will work our hardest to defeat this virus and to deliver vaccines to residents who, without our help, would not be able to be vaccinated.
Thank you, Kelly. Questions? Do you want to speak, Chris? Okay.
Governor, question about the redirecting of the tens of millions of dollars to some of those cities. What in the end made you do that? Was it conversations with local officials there? Was it pressure from the delegation? Why did you decide to do that?
Well, when this issue was first brought to our attention, and when you look at the numbers, just generally, when you have, what I would describe as relatively better off financially communities getting $70, $80, $90 million, and you have places like Chelsea and Everett and Methuen and Randolph, which have been hit pretty hard by the pandemic and don't have the kind of resources many of these other communities have, getting $6, $7, $8 million, it was pretty clear that there was a problem there. And we began a series of conversations with the leaders in those communities to try and figure out sort of how to frame what we might do together to solve it. And once we reached what I would describe as a general agreement about the problems they were looking to deal with as part of their own initiatives, we then talked to the folks in the legislative leadership here about incorporating that into the planning that we're doing with respect to how we do allocate federal resources that are part of the ARP. And we reached out to folks yesterday and told them.
Can you give us an update also on the FEMA mass vaccination site? We heard that from you first in that hearing the other day.
I don't remember how long ago we applied. How long ago did we apply for that FEMA site?
The initial was in February, and then early March.
So we've been talking to the delegation about it. We've been talking to the administration. We applied in February. We expect that we'll hear sometime soon.
Where would you like to see it go?
I'd rather talk about where it would go after I find out if we're going to get one.
Governor, the federal government is expanding eligibility for vaccines to some essential workers who are still not eligible in the state, like construction workers, media, law. Would you consider to avoid confusion, bringing those people into the state program?
Okay, I'm not familiar with, when did they announce this?
American Rescue Plan as well.
It was in the legislation? I'm just not familiar with this. When did they announce it?
It's part of Biden's plan. It was in a news release that the White House put out, along with the money that, is being allocated to states and the federal government, and also just saying that people in the 1C tier, which is essential workers, are now eligible.
I'm not familiar with this list. We'll obviously talk to the team about it and discuss it with the Vaccine Advisory Board. We've tried pretty hard to make sure that there's some alignment between what they're talking about and what we're talking about. But I'm not familiar with this, so we'll have to get back to you.
I remember you said that the mass sites now, everyone's allowed to go to the mass sites. How does it work with the federal, like the community health centers, or if they do change their eligibility at all? How does that work? Is everybody eligible to go to any site, or is it just the mass sites? Like if it's community health that are federally fed vaccine directly?
Well, there are currently two big channels that the feds support directly. One is the retail pharmacy channel, and the retail pharmacy channel, for the most part, abides by guidance that they get from us and from the feds about eligibility. And there hasn't been that much of a difference between their rules and ours. The community health centers are, for the most part, relying on the guidance that we've put in place, but they do serve, in many cases, patient panels and folks who are vulnerable, and they do make decisions about vaccinating based on that as well. Are you saying that the community health centers are also part of the universe that would be associated with what you're talking about?
Yeah, the Biden people had put out that they were going to allow, if they're getting directly from the feds, that they were going to increase the essential worker categories all the way down to this 1C category.
Okay, I guess the one thing I would say is community health centers are doing, they're over 80% at this point, aren't they, on their...
They're definitely improving their distribution to administration.
Yeah. I guess the one thing I would say is we want to make sure they continue to take care of the people in their communities. And I would just want to have a conversation with the Mass League and figure some of those issues out as well.
Governor, could I ask you about homebound people? What's the universe? How many people are we talking about? And do you get the sense that most health departments do want to reach these people as opposed to going through?
Do you want to speak to that? I'm going to let the Secretary handle that one.
So the universe is about 25,000 individuals, and it's about 170 local boards of health will be responsible for who stepped up. We surveyed all of the local boards of health, like who wanted and could do this work, and so it's 170 of the 351, and then Community Care Alliance will do the remainder. And it, around the population, it's about 60% of the population will be covered by Community Care Alliance.
How many
Can you
vaccines?
explain the timing? Why now? Is it because it was so complicated, or is the timing now just because this is what we want to do?
This has been, as we continue to roll out the vaccination program, we always knew that there would be individuals for whom we have to go to them, whether it's in certain communities of color, disproportionately impacted communities, and individuals who are homebound. The federal government came out with some guidance on definition of homebound, but we've been working with, as I said, Commonwealth Care Alliance, and since they're a health plan, they have done this very successfully with the 500 members they have within their duals program. So it just seemed like the right time, and we needed J&J. J&J really is one of the things that makes this the ability to just roll this out. And we've, up until this point, we've had, limited to the state's distribution, we've had a limited amount of J&J. But this bolus of 41,000 that's coming in for next week at one time really allows us to just now implement the homebound program. We actually have sort of softly launched it this week to just make sure that the call center works well. We have 180 trained staff, Commonwealth Care Alliance, the local boards of health are all ready to roll. So that's why.
How many vaccine doses roughly at this point are you estimating will go to this particular program? And will it be a new category then with the new Johnson & Johnson doses coming in, or how will that fit without everything else you're prioritizing?
So we will, so tonight is actually the night when we sort of sit down and do allocations for next week. But this is, obviously it's about 25,000. Some have already been vaccinated. And so we'll receive requests from the local boards of health as well as from Commonwealth Care Alliance, and we'll start to roll out the J&J. This is an estimate, and I don't like to speculate, as you know, but this is about probably 10,000 of the J&J we will have for this program as we roll it out.
So the J&J is kind of reserved for these folks? There's not a lot of J&J going to the general public.
Right. So we like shots in arms. So this is to really roll this out since we're getting this one-time bolus of J&J. There's nothing estimated for a couple weeks going out. That about 10,000 of this will go for this program, but they have to administer it, sort of quickly.
Governor, can I ask you about the pre-registration program? Your Secretary of Technology said the other day there are still discussions ongoing to allow people to pre-register at a place other than a mass vaccination site. How much closer are we to that?
I would expect that you'll start to see some of those folks who choose to join, joining over the course of the next 10 days or so.
I feel, Governor, like it was.
I do want to say that I've said this many times to all of you, that mobility and outreach and, hitting community centers and senior centers and homebound populations, the J&J vaccine, because it's a one dose and it doesn't require a lot of the issues associated with storage and prep, is a tremendous asset. And if we do see more of this from the feds, it will make it possible for us to do a lot more of this, just period, across Massachusetts.
Speaking of the pre-registration system, I felt like it was Christmas morning. I got my text today saying it's my turn. So I signed up for April Fool's Day just because I have a weird sense of humor. But what is
We all know that, Jonathan. Yeah.
What's your status? Have you gotten the magic text and are you going?
I have not gotten the magic text yet, but when I do get it, I'll pursue it.
Governor,
Sorry.
Yeah.
I'd like to ask you about something that was raised at the oversight hearing about vaccine passes in some form or another. Other states, other countries are exploring this. What's your thinking about using that going forward, either for private businesses or a wider program?
So, frankly, I'd love to see some guidance from the feds on vaccine passes, because I think having, 50 states doing 50 different things on this could get pretty complicated. I think there are two big issues we really need to figure out. One is, do we need a law change to actually, have that kind of a program in place? It's not clear at this point what the answer to that is. I do think that it's a conversation that's worth having for all kinds of reasons. But again, I would rather see the feds give us a framework to begin with. And secondly, we need to figure out if we need a law. And then if we need a law, we have to figure out how we would frame it going forward. My guess is you would probably need a statute of some kind, because there's probably very little in state law right now that would make it possible for you to do something like that.
Haven't you ever referred to private businesses probably having discussions about their employees? I don't know if that's a similar thing, that they might require employees to get vaccinated.
I haven't heard many employers talk about that. What most employers have said to us is, get as many people vaccinated as fast as you possibly can. And that's really been the strategy that we've been pursuing as well.
How do you verify people in the phone line?
The lines are extending until the 11th now, and people are complaining that they can't space on our buses. Are you hearing any feedback on that?
Say again?
Frustration with the orange line now is going to be extended until the 11th, because people are having trouble spacing up on the buses. Are you hearing anything on those lines? Are you concerned that it's taking this long?
I talked to, are you talking about the investigation?
The derailment and the orange line.
The investigation that took place on the red line took a lot longer, certainly, than I think a lot of us would have wanted it to take. But, investigations take as long as they take. The T is thoroughly focused on getting to the bottom of what happened there. And they work pretty hard to make sure that they add buses to routes where they have passengers, and they add trains in places where they have passengers to make sure that there's available social distancing. It's a core philosophy that they've been operating on. I would love to know what the results of the investigation are. I would also like them to be right. And if it takes them a little longer to figure this out, it takes a little longer. I trust they have the right people doing the work on this.
Are there ways to verify that people using the phone line, in fact, are homebound without creating too many barriers? Or how do you strike that balance, especially considering some people were, trying to take advantage of the caregiver exemption that existed last month?
Steph, I don't understand the question.
When people call, how do you strike the balance of not creating too many barriers, but also making sure that people who request the homebound vaccinations are in fact homebound?
Thanks. So there's a screening process. It is meant to be as barrier-free as possible, but there is a series of questions we'll ask about where you get your care now, how do you receive it now, so to screen out people who may have mobility challenges And if you have mobility challenges, but you don't need a two-person assist or an ambulance to get to your medical appointments, we will then help figure out how to get you to get vaccinated. So it is meant to be as barrier-free as possible, but there is a series of questions to queue you in for us to then schedule.
Thanks, everyone.
Do you want to get Bruce? You started to ask a question.
Yeah, I was curious that the speaker this morning delivered a speech to the Chamber of Commerce where he talked about.
The reason he's in a hurry is because I have to go to another event because this press conference got moved because of the speaker's remarks.
Okay. I don't know if you had a chance to hear about them, but he was talking about offshore wind and launching a sort of, it's vague, but a large-scale program to invest in training and onshore investment. Is this something you would support? You want to get behind?
Well, first of all, the Biden administration has already demonstrated a far more enthusiastic interest in offshore wind than the Trump administration did, which is a hugely positive development. I mean, I think most people in Massachusetts know that the legislation that we built our wind program around passed in 2016, and we were one of the first states to actually put a large, fully developed proposal in front of the federal government, and we lost a long period of time as that thing went through review. Now, there are still going to be issues associated with the impact that deepwater wind has on the fishing industry, and I do think a lot of the work that was done over the last year or so, 2 years, has provided at least kind of a framework for taking a look at how to handle those issues and how to mitigate. But I would love to see significant urgency brought to the whole question of offshore wind, and we continue to make investments and have made investments in the South Coast as we've moved forward on this. And if this is something that the legislature wants to work on, I think it's a great idea, because if you believe that there is going to be a very significant wind presence off the east coast of the U.S., and I do, started, by the way, by the bid that we did, which proved to people you could actually do deep water wind and make it affordable. There's going to be a ton of work that's associated with that, not just in terms of the turbines and the platforms, but all the issues around transmission and infrastructure that are associated with that. So I think that's a big opportunity, and that's definitely something we'd look forward to working with the legislature on.
Governor, you can answer the climate bill?
Yes.
Could I ask you real quickly about the schools? 77 districts applied for waivers. Is that a disappointment to you?
Well, a bunch of the waivers people applied for had to do with cohorting kids, which is appropriate. I mean, I don't think the department was particularly concerned about those. In some cases, they raised some pretty legitimate questions. But 90% of the school districts in Massachusetts are going back at the beginning of April, which we think is great. Some of the bigger districts have more complicated challenges associated with that, and they're going to be a couple of weeks behind the ones that go first. But at this point in time, pretty much everybody's going to be back in person in the month of April, and we have 177 districts so far that have signed up to participate in our weekly surveillance program, and many districts that are currently doing it, and it's been a tremendous asset to them in providing kind of a sense of security about what's going on with COVID inside their facilities and their operations. So I'm actually pretty excited about where we are.
Thanks, everyone.
Thanks, everybody.
Thanks, everyone.